Hello, and welcome to today's webinar, Beyond Star Ratings, Innovative Strategies for Engaging Medicare Members. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today Dr. Catherine Bass, Glenn Leary, Stacy Walters, and Kathy Feeney. Dr. Bass serves as the Senior Director of Informatics and Innovation at OnLife Health. Her areas of responsibility include data science, advanced analytics, reporting, and research. As Vice President of Sales, Glenn identifies, cultivates, manages, and supports strategic partnerships with health plans, employers, and major benefit consulting firms nationwide in the health and well-being market. Stacy is the Director of Medicare Advantage and Quality Management at Blue Cross Blue Shield of Alabama. Since joining Blue Cross Blue Shield of Alabama in 2003, she has worked in a variety of capacities, including, most recently, overseeing the risk adjustment and star rating efforts for the company's Medicare Advantage and ACA products, and leading development of a new Medicare Advantage division. Since joining Florida Blue in 2018 as the president of the Medicare Organization for GuideWell, Kathy has been responsible for ensuring a successful and efficient health plan operation and for achieving profitability. At this time, I would like to turn the floor over to the speakers.
Thank you, everyone, for your time today. This is Glenn Leary. I am VP of Sales at OnLife and super excited to moderate this session with Dr. Bass, Stacy, and Kathy. So thank you, everyone, for taking the time. I know it's an extremely busy time of year for open enrollment right now, and everyone is extremely busy on execution and their implementation. So thank you for the time. We have a very busy agenda today with lots of stuff to cover, and I wanted to thank everyone for attending and the panelists. What we're going to talk about primarily are star rating strategies, and then also new and innovative approaches to member engagement. And I'm super excited about how the panelists are going to talk about their personal experience and success as it relates to personally connecting with seniors, omni-channel, making that real, the digitization or digital natives, even a little SDOH and other things like that, and then ultimately aging into Medicare and what does the future look like. So with that, I'm going to kick it off with question number one. We're going to do a series of questions with the panelists, let the conversation flow kind of organically, and for sure, reserve 10 minutes at the end for questions. So please submit your questions via the chat, and we'll grab some of those during the natural flow of the conversation, but certainly at the end, we're going to get to as many as we can. So with that, I'm just going to open it up with star ratings and what plans you can do to improve their performance on star ratings. And so I'll start with Catherine on star rating strategies, and then move to Stacy and Kathy. So Catherine, could you start on how health plans, what they can do to improve the performance on their star ratings?
Yeah, thanks so much. And Stacy and Kathy can also speak about the myriad of solutions that sort of surround Medicare Advantage stars ratings. There's so much work that goes into that. But from a data perspective, I think one of the most important things that we can do is really focus on all the different data sources that we can take in that really give us that clear picture of the member. When we have a very comprehensive and clear picture of who that person is, including all kinds of different data sources that are outside of what we may consider sort of traditional healthcare data sources like claims data and that kind of thing, we get a better idea of how that person may want to be engaged with, what's important to them, what we could put in front of them that might be relevant to them and therefore capture their attention. I think that's a really big piece of this. And one of the things that we have found that our health plan partners really find valuable are the personas that we create. A lot of health plans have their own personas that they're creating based off, again, claims data utilization, perhaps consumer data, whatever they've kind of curated in that space. But I think what we can offer there is there some additional data that we're bringing in that they may not have access to. The health assessment, for example, is a great source of that because it's talking not only about that person's health status, which you can get from other sources, but also their self-reported health behaviors, the things that are concerns for them, including things you mentioned, SDOH, which is social determinants of health. For anybody who may not immediately make that connection to SDOH, it's just easier to say SDOH because social determinants of health is such a mouthful. But, I think when we take that information in, package it up in those personas, especially when we can marry that with the way in which members have already engaged in our platform, it gives them a greater sense of who that person is and maybe a little bit of insight from data sources that they do not have yet. And so putting those personas together helps us understand, for example, some of the distinct clusters that you might find in that membership. So, we have some that are in our personas much older than the rest of the group. We have some that are slightly younger, some that are more technologically savvy, others that may be more likely to close gaps than others. And so just those little nuances of information can be really helpful in understanding how to allocate your resources, understand how that person may want to be engaged with, and then really do a great job of capturing their attention when you've got it and helping them do the next right thing to do, how it relates to their stars engagement, their gaps in care, and that kind of thing. So I think that's a really big piece of how we can support that and what is important to keep in mind when you're thinking about this population. It's really important to understand who they are and not make assumptions. You often hear like, oh, well, this is the retired population. They're not really going to use smartphones or apps. And that's just not the case. There are some who will not, absolutely. But there's a lot of them who will and who will use digital tools and those kind of things. And so understanding that is really important for engaging these people effectively.
Awesome. Thanks, Catherine. And I think, during the course of the different panelists today, we'll talk a lot about data. We'll talk about personas and how we're leveraging data and different experiences. So thanks. So Stacy, how about you in terms of Alabama and what you guys have been doing for improving star ratings?
Thanks, Glenn. I think it's a great question. And what I'll say really kind of mirrors a little bit about what Catherine said. But, I think in the past, there have always been, these tactical approaches to some of these measures and improving on these measures. And I think there will always be a little bit of that, hey, there's the specific measure. What is the very specific tactic that we want to implement to help improve this? But more and more, the star rating program is really more about how you just overall operate your plan and take care of your members. And I think, we all see that with the movement of the weights to, member experience being weighted so heavily. And you can't, there's not like one specific thing that you can do that says, okay, this is going to increase my rating of the health plan or rating of the drug plan. So it really is about understanding your members, understanding their pain points and what's really important to them. And I think the plans that can do that the best, I think it's going to benefit all of our members and all of our seniors, and it will ultimately result in being successful in the star ratings.
Perfect. Okay, well, Kathy, if you could round out this question just on star ratings, and then we'll move on to kind of a personalized connection. But that's what Stacy was mentioning, is a more personalized approach and understanding the members and their pain points. But Kathy, how about this from your perspective in terms of what we can do to improve?
Yeah, thanks, Glenn, and good morning, everyone. And just to punch home some things that Catherine and Stacy just mentioned, knowing as much as possible about your members as people, individual, is so critical for proper engagement so that people can receive the care actually that they need. And developing personas are critical, really, really critical. But what we've added to that, and I think, Catherine, you mentioned this somewhat in your comments, but we've engaged and have working with this behavioral science team, and with their expertise, we can be more impactful with our outreach so that it resonates with each individual as we're calling, that will compel them to do what's going to be best for them to round out what we need to give them the best health experience and to meet their outcomes and to really meet people where they are. And with the recent changes in the weighting of all member experience, whether it be CAPS, et cetera, it's really, really critical with the data that we have and the analytics that we have that it goes beyond just the personas, but taking into account people as individuals and human beings. We're all kind of wired differently, if you will. If you take a group of raccoons, you all think they look alike, but when you really drill down and get to know personalities, everybody's different. So I would just punch that home and end with, we have to think about what's really conscious on people's minds, but getting down to that unconscious needs that people have.
I want to build on that just a little bit because, Catherine, you mentioned it pretty quickly in the introductory kind of first things that you said, and tying together what actually Kathy and actually Stacy was saying in terms of data analytics, right? And really getting a deeper understanding of that member. Catherine, can you talk a little bit about like how you, in your experience, have leveraged data to understand seniors better?
Yeah, absolutely. And Kathy, I'm absolutely going to steal that raccoon analogy. That was great. That made me chuckle, and I will use that in the future. But it's such a good point. I mentioned personas when I was just talking a few minutes ago, and there is certainly a place for personas, and there's a way to use those that are really effective. I think even more importantly, and this is I think what you also heard Kathy kind of reiterating, is understanding that even if you've got some naturally occurring data that clusters together and people have some similarities, whether that is the way in which they engage, the way they behave, their age, their sex at birth, whatever those things might be, there are still nuances to the way in which people want to engage and want to consume data. So, we could all be in the exact same persona and still have differences in the way in which we might interact with the system or think about our healthcare, think about those preventative exams. And that's why it's so important to really curate all that data that you can and try to understand those people as much as possible. I think the other thing that's important here when you're thinking about understanding members, there is something to be said for actually engaging with the end user and making sure you're understanding, what kind of things are important to them when you're thinking about that. But I also think there's a big piece of this puzzle that really, and probably going to sound a little bit biased since I'm coming from the data side of things, but really makes it imperative for you to focus on the data. And that's because what we say and what we do are oftentimes different. And when you're talking to people, and it's not if you're asking things about like what are their concerns and that kind of thing, but if you're asking them about how they behave and what they would do, that oftentimes is that there's some bias, there's some inherent bias in that when people answer those kinds of questions. So I think it makes it even more important for us to really focus and hone in on the data and then have some of that qualitative sort of wrapped around it. Because again, how we behave, how we actually behave, and how we say we may behave can be disparate things sometimes. So if you're looking at that data and you can understand 5 or 6 different clusters that you want to kind of use for promoting content and programming. The other piece of this is really making sure you're getting down and you're spending the effort when you're thinking about personalization of getting down to that single instance. So making sure that you're doing things, I often will reference like taking a page out of the book of the consumer engagement giants. Think about the way Netflix interacts with you, Pinterest, Amazon, those leaders in the consumer engagement industry. They are tracking every single click. They're getting down to things like, where your eyes kind of move on the screen, that kind of stuff. And, maybe you don't have to go that far, but it's all about really understanding every single thing that you can about that person so that you can make their experience as personalized to them as possible. And it's not just the electronic experience. It's also potentially like what time of day. They may open emails in the morning but never look at emails again, or they may not look at their emails until the evening, or text messages may be something that they'll look at throughout the day. Phone calls they never answer. There's a lot of those things that are beyond the way they're clicking around in your experience or your website, that you can also take into account when you're thinking about how do we actually reach out to these people in that personalized way, because that's what everybody expects these days. That the bar has been set very high, and we all have, frankly, some catching up to do, to kind of mimic some of those really engaging experiences. But I think we're all heading down that path because we realize the importance of it and are focusing really on the data. The data is king, and leveraging that data in a really smart way is what's going to be the key to unlocking that engagement.
Great. So before we kind of transition to kind of an omni-channel execution, or how we actually leverage this data to communicate better, each of you have touched on that just a little bit. But before we go there, since we're on the topic of data, and Catherine, I just wanted to give you just a little breather, but before we leave data, SDOH, or social determinants of health, is hot, and it's some people think it's just a buzzword. Catherine, can you comment a little bit from a senior's perspective, how you have worked with data for social determinants of health and translated that into programming? And possibly Stacy and Kathy can talk about that as well. And I don't want to go down an SDOH path for 15 minutes, but let's touch on that, and then we'll get to omni-channel communications and how we actually communicate personally with these members. So Catherine, can you talk a little bit about that before we segue?
Yeah, I'll start on that, and I would love Kathy and Stacy's, kind of comments on this as well, because I have also kind of heard some of the same remarks here and there that, SDOH is just another buzzword, and I have to say I fundamentally disagree with that, because, when you really think about SDOH, and it's about all the things in a person's environment that affect their ability or likelihood to make a healthy choice. So it's not just about education and awareness, which, when you think about program planning, for those of you who kind of come from that background, one of the things you always think about is making sure someone is aware that something's out there, that they've got a benefit, that there's a resource, et cetera, and education on those things. And the reality is that is a piece of that, but it's kind of a small piece of the pie when you think about all the other things that are sort of in that person's life that would enable or really disable them from being able to take advantage of those things. I mean, transportation is a really easy one. So if you've got, these great pharmacy benefits, or, all of your doctor's office visits are covered, whatever it may be, but you cannot get there reliably, then that's a real, point of conflict for actually having that behavior to be achieved. And so if you understand social determinants of health and where the vulnerabilities lie for people, I think this is something else that's, when I was mentioning, we've got some data that the health plan doesn't always have access to kind of right up front through the health assessment. Social determinants of health data is publicly available. We use the behavioral risk factor surveillance system and the U.S. Census data to get that information, but then we're also asking our members, do you actually suffer from this vulnerability? Because when you can marry those things together, and I know, like, if someone has a transportation barrier, if it's not, they may have a transportation barrier because of where they live, but they may not actually suffer from that themselves. Maybe they do have their own car or a reliable ride. So it's about understanding where those hot spots of vulnerability are on a global level, so that you can think about resource allocation, your programming, but it's also about marrying up that data that you can get the verification of that from the member, so that you do have that really accurate picture of them, because that can help you understand how to leverage some of those benefits that have come out with some of the changes in the last couple of years, or how you actually might need to think about what your programming is and why there's been uptake or not uptake. That can often be a big piece of that. So that's kind of where I think about it and how that affects the way in which we interact with our members. But I would also love to hear, Kathy and Stacy's perspective on that, because I think it's a really fundamental piece of how we interact with this group.
Great. So thank you so much, Catherine, for that. Kathy, would you mind talking a little bit about how you guys are leveraging the data? I mean, you mentioned behavioral scientists and teams. As we move into now the section, I want to talk about which is member engagement, right? So how do we leverage data into the right type of way of communicating with someone from an omni-channel perspective? But for now, given all that data discussion, Kathy, would you mind talking to us a little bit about the translation of data into engagement?
Yeah, thank you, Glenn and Catherine. I'm busting at the seams to just get into the conversation. Everything you said is so important. There's one thing in discovering the SDOH challenges. That's where we are today. By identifying resources is another, but actually connecting the member to these services is key, and most successfully done with the help of education. And there's some things that we have instituted that many other people probably have too. We have what we call community health workers that either meet with people where they are at their home, actually will do phone conversations, actually will describe to people how they get transportation, or actually will do and execute on the transportation. So it's understanding those challenges and then closing those gaps, but it has to happen in conversation, not just by an email. And one critical component of all this is that with our provider groups and helping educate that staff, et cetera, so that they know where to go get help, so that they can connect the patients, if you will, so that that member or that patient-provider relationship is so critical in the delivery of care. And one of the other things that we've done, and we've created much still for people who don't want it digitally, but connecting people with the flu shots. How do I get an appointment with my doctor? And we can electronically do that now. If I have hearing issues, if I have food insecurities, and they may not just plain say I'm hungry, and how do I help get some food, that we can work through them through that plan that has access not only to them, but they can assign a caregiver in that plan, so that that caregiver is involved, and then they can go even as so far as to put a provider in place, so that they're working that community all at once. So I'm just going to underscore, you got to go where the rubber meets the road. This is one at a time. You got to grind it out, and one size does not fit all in this. And everybody needs a helper.
I love how you connected
Kathy,
that
I wanted
to the social.
Oh, I'm sorry, Glenn. I wanted to jump in for just 1 second, because something Kathy said I think is a really important piece, and I was just talking about this the other day, especially when you're talking about SDOH stuff, because that is stuff that can feel inflammatory or judgy if you're not careful. That is an opportunity that we also took to work with a behavioral economics team. Kathy mentioned that when she was chatting about how you're framing this stuff up, and that has been an excellent resource for us. So just wanted to also kind of echo what she was saying. And if you've got access to behavioral economists, they are fantastic resources, especially if you need to promote something to members that could feel a little bit like we need to be careful about how we say this, so it feels like a resource and not sort of a judgment on how your your sort of your circumstances. So just wanted to echo that out there, but please go ahead.
No, jump in. You guys are truly the experts, so thank you for that. I want to ask Stacy to kind of build on what I was just going to mention. Is, Kathy, I loved how you said, hands-on. It's super important for the provider groups and that, the patient-provider relationship, but also the community social workers really making a huge difference. So, Stacy, anything to add from an engagement perspective when you think about data, the translation, even, possibly the behavioral science aspects?
Yes, actually, and before I touch on that, I wanted to go back to something really quick that Catherine said on the personalized connection. One of the things that we found when we were doing research and talking with our members is not only is it key critical, but they also think it's really easy for us. They to your point about the experience that they get from some of these other industries and just how the world is changing, it's not only an expectation, but the fact that we don't do it, it's like, why would you not do that? That's really easy. When you get inside the walls, it's never that easy. But the expectation is that it is easy. So completely agree that is something that we've got to get better at. So SDOH, so we've actually spent a lot of time building a strategy around SDOH, and what we like to say is it's really about trying to influence the life chances our members experience in order to give them the best possible set of life choices. And we've really structured it in 3 ways. One is the data and what types of data. As Catherine mentioned, there is some publicly available, but then there's also some that you can get directly from your members. And then, so it's the data, and then it's, the analytics with the data, and then it's the solutions, and what solutions can we put in place to help our members. And we put it in really 2 buckets. One for us is at the aggregate level, so where we're trying to do things to help the community. And then secondly, it's at the individual level. So what can we do to help this specific member, whether it's, health literacy or whether it's meals or transportation. And I 100% agree with what Kathy and Catherine said about the behavioral component of this. We've identified 8 that we want to focus on that we believe we can impact the most. And some of those are not, identifying here's a vendor I can work with or a solution I can put in place. It's more about a conversation, and having that conversation and how we have that conversation is very, very important, because these are, touchy subjects that things that people may not even want to openly admit that they have a challenge with. So I completely agree that is a very important component of this conversation.
Great.
Hey, Glenn, this is Kathy.
Perfect.
Can I put icing on the cake on this from what everybody said? So
that's a perfect
I am
segue.
a senior.
Thank you.
I'm 65, and I won't say how much older I am than that, but it's really being able to feel the experience that you go through when you hit 65. It's kind of like, people start talking louder to you. I said, I can still hear. You don't have to talk louder, and all I want to do is have a connection and have it be individualized. So I want people to see it as through the eyes of people who are experiencing it, and being part of a health plan too. So I wear both hats. We sit in a room and we talk about all this, and we get all the data together and but it's actually getting down to that individual. So we both have to see it together, the health plan and individual, and then we both have to own it. It's just not about the health plan calling us, hey, do you have transportation? Did you get your flu shot? But it's that I can pick up the phone and call if I have an issue, and that I know I'm going to get help, and then we all do it together. So I call it the see it, own it, and do it. And it does come down to a 2-way relationship that has to start occurring. And you just have to have access and to have people talk to you. That seems simple, and I think, Stacey, you just said it. It's not. It's complicated, but we're going to work through it.
What I love about that, you guys, and I know it's complicated, but we have more and more data. More data is coming. How can you translate that in a thoughtful way for an informed conversation? Whether that be in person, whether that be a digital native. So I want to bridge to this next topic, which is when you think of the right combination of communication channels with that person. And Kathy, you set it up beautifully. I mean, it may be in person, right? But it could be other ways too. So Kathy, could you keep going, and then I'll turn it over to Stacey. When you think about all this data and you think about the behavioral science inputs, then what is the right combination across this continuum of seniors? So Kathy, can you take that?
Okay, can you hear me? So not to promote a brand, but I call it the Burger King way, that you can build the burger the way you want it. If you want to be talked to in person, you have an advocate to do that with, and someone that is knowledgeable about what's available. If you want to go in and visit someone personally, such as you have brick and mortar in the environment and you have areas that you can go, whether it be through a provider, or we may have different structures out there in the environment. We also have people that will come into the home if that's where you want to be visited. Or maybe you just want to be online and you go through your portal that some of us have established, and you can talk that way and do it via chat. So you can visualize that. And Amazon doesn't have in stores, but I think they're starting to put up some retail stores. You can get talked to any way that you want to and to get the information. But the fact is, you have that mindset that people are going to help me no matter what. And if I get the wrong thing, I can return it, no questions asked, just drop it off at UPS and they take it. And so trying to translate what Catherine was going to in the beginning, that it's not one size fits all, and we have to be available, and it's what you're calling the omni-channel. But again, it comes down to personal preference, and guess what? Personal preference could change depending on what the subject is. And so I'll hand it to my colleagues now to opine on that.
Yeah,
Well,
so Kathy,
Kathy,
I know this is, yeah, go ahead, Kathy.
Oh, sorry, Glenn. This is Stacy. I was just going to say, I just wrote down not one size fits all, and I mean it's exactly right. You know, it goes back to personalization, and you know, a lot of people on this call, I'm sure, do a lot of engagement with physicians from a STARS perspective, but it's the same thing with the physicians. There is not one size fits all, and we are in a very dynamic world, and we have to be dynamic and meet our members where they want to be met. I think we all see data that engaged members really have better experiences. They have better health outcomes. And so we want to engage them, and the best way to do that is to meet them where they are, the way they want to be met. So you have to have options, and you have to be flexible. Again, it's, sounds really easy. We all know it's not, but that's what we're going to have to be to really serve our members the best that we can.
Yeah, I agree. I mean, the execution of this, when you think of the traditional paths of print, phone, in person, and increasingly the digital natives. So let's talk, before we move off of the kind of the omni-channel topic, I'd love for you guys to talk a little bit about how you combine now increasingly, seniors are very digitally native. So Catherine, can you talk about, design elements in kind of a user experience and that ties to the seniors that are more digitally native? And then I'll turn it back over to Kathy and Stacy for that as well.
Yeah, absolutely. I mean, some of the things that we're doing is literally just following guidelines about how seniors react to things like white space and that kind of thing. And, making sure we've got, sort of a kind of light purple kind of, how do I say this, little like transparency over all of our slides so that there's appropriate contrast. I think those kind of things are really important to understand and make sure you've got that kind of thing in place. But then also, I think it's back to those, what I was saying earlier about not making those assumptions about how people want to interact just because they may be a certain age. Kathy, I loved what you said. I've heard my parents say the same things, like all of a sudden, maybe you get some gray hair and then people turn up the volume every time they're talking to you, and it's kind of an interesting thing. It also has made me very aware of not doing that. I'm wondering how often I might have been doing that same thing. But from the data kind of standpoint, I think it's, again, really important to understand how you're presenting information. And Kathy, you were talking about how Amazon has set that bar with how you return things and everything. You're always going to be able to get help. That is kind of the bar that I think about and try to always kind of bump up our stuff against, to say, how can we make this more Amazon-esque? And I think one of the things that I consider is, what are we putting in front of people and how are we wording it? What text are we using so that, first of all, it is simplistic, to stop trying to be fancy and all those things, but make it as simple as possible for someone to see what it is that you're sharing, whether that is information, more importantly, a call to action, and how you're framing that up. Back to, again, working with your behavioral economics team if you have access to that, which is such a great resource. so that you're thinking about not only physically how you're presenting that to somebody, but then also what you're saying and making everything as clear as possible. One of the things that we make sure we are highlighting for people is, particularly when there's an incentive involved with this, and especially with this population, something that I have noticed in the last 5 or 6 years as we've been working with this population in comparison to the commercial population, is that the retired population is motivated by a smaller incentive amount, which is pretty interesting. And so where you can use, a $10, $20 incentive on something that may not be effective necessarily in that commercial population, it's very effective with these people. And so making that super clear on the screen for them, associating it very tightly with whatever the activity is and the call to action, we have seen better click-through rates when we have that kind of experience. Piece of that, saying this over and over, it's a bit of a broken record, but when you know that person as much as is possible through data, you can also put things in front of them that are more relevant. And our attention span is very divided these days. We have our watch going off, email notifications, your phone is buzzing, there's TV on, there's things everywhere. So we're constantly being distracted. And so when you can put something in front of somebody that is relevant and will capitalize on that fraction of attention that we can get from them, then you're also more likely to get them to do something that you want them to do. Research shows that when you put something in front of somebody that is relevant and feels like a relevant action, they're more likely to come back and do something else, which I also think is maybe the even more powerful piece of information. We want this person to do something, but we want to really establish that rapport with them to be that trusted resource that they can come to. And so if we can put things in front of them in a way that is easy for them to use and is very clear about the benefit that they're getting out of it, make it simple to do those actions, reduce that cognitive burden on them to make the choices they can make, then they will also come back and do something else, which I think is really, really powerful. So I think all of those things together are really important as you're thinking about that user experience and the user interface that you're putting in front of those seniors and how they will interact with those things, because they are more used to digital things than maybe we've assumed in the past years. And so they are also accustomed to the same kinds of experiences, again, through Amazon, Netflix, those kind of people who are constantly doing and pushing that consumer engagement bar higher and higher.
Thanks, Catherine. So Stacy, as you think of, right, like Catherine said, putting things in front of them, kind of a proactive approach to that digital experience with rewards. I know that in Alabama, I think you guys have done quite a bit of work on this, but can you talk about your point of view on kind of that digital experience, and then I'll turn it over to Kathy as well.
Yeah, sure. So we have done quite a bit of work, and really the 2 points I think that Catherine made were make it useful to them, use the data to say what do they need, what do they want, and then also making it simple. So we have a rewards program that we use, and really it's the next right thing. What is out there to show them? What is the next thing we need you to do? Whether it's a breast cancer screening or it's get your annual wellness visit, and then there's an incentive tied to it. So the way that it is shown to them is their next available step. So it's just making it very, very simple. And I think, sometimes we will, our organization, like I'm sure most of everyone's on here, it's a very member-centric culture. We live it, we breathe it, we speak it. But I think it is very easy sometimes when you are, sitting in your meetings, sitting at your desk, whether it's at home or in the office, and just you kind of get busy doing your work and doing your job, and the member is there, but it's kind of in the background. And I think a mistake we make sometimes is putting that member in the background and forgetting we need to design this based on what they want and what they really need, and that's where the data comes into play. And then it's making it so simple for them to act on. So in addition to the digital platform that I mentioned, we also send these scorecards twice a year that are personalized to the member to say, here are the things that we need you to do. And they're different based on what they have done, what's still outstanding, and then you tie the rewards to them. So it just makes it very simple for them to understand what is the next step for them to take in their health journey.
time. We've got about 20 minutes left. Kathy, I'm going to turn it over to you to close out this digital native topic, and then we're going to move on to what are the most popular programs and aging in a little bit. But so Kathy, from a digital perspective, anything you'd like to share in terms of the digital natives in Medicare?
So what Stacy was just punching home, there's not a silver bullet. There's a cry to make anything relevant to the situations, and all the more we can do to get alignment with that as an industry and do some cross-cutting initiatives that will make the world ahead of us more simple. We all do things differently, and we need to create, if we're going to stick to the Amazon way, they're consistent. It's like the McDonald's French fry. But we all have to rally around this effort. There's enough for everybody out there to grow our own businesses, but we're dealing with human beings. We're dealing with individuals. And frankly, the reward systems, just to round this out with the stat, there's 73 million of us that are going to age in from being born in 1946 to 64 baby boomers. Everybody will turn in that era 65 by 2029. And so there's a lot of people in their 60 to 65 range right now that are in reward programs, that are on the commercial book. So they're already experiencing it. So we're going to get some extra help for those of us in the senior business, but we don't have to change it over to a whole different system. We can ease people in. It can just be, if you turn 65 and you're still using Amazon, it doesn't change, right? The more we can do that, it'll make our lives easier as seniors. So I just will end with that.
Thanks. So the next two topics that we want to cover before we get to questions are the most popular programs. I mean, a big part of increased engagement from year to year is offering programs that are most appealing to this population. New innovative point solutions, things like that, or even design changes. So Kathy, can you talk about, from your perspective, and then Stacy, what are some of the most appealing new programs you guys are thinking about or you've done that you're excited about for this population?
So I'll just jump right in, and we're right in the midst of AEP, so that's the open enrollment period for us in Medicare. Regular benefits with copay and coinsurance are kind of table stakes today. What people are really looking for, and I'm also not only going to talk about the member, but I'm going to talk for the stakeholder behind the scenes called the caregiver. Things that are becoming really, really important, and more so than not, is complete dental coverage. Being able to get a decent dental plan. Hearing and vision are right up there. But this sense of OTC, the sense of I can get, I have a payment card now that are out there where I can have some discretionary dollars to be able to go and buy what I need for my healthcare needs. Also, what's going to emerge, at least my opinion, is this home health. So anything that we can do to subsidize that, to encourage people to get that kind of help, the caregiver support, et cetera, home help hours, et cetera, that's going to it plays a major role today, but we're seeing more people gravitate towards that. And then these food cards that are out there, there's more hunger in this space than one even wants to comprehend. So that's resonating out in the environment. Stacy?
Kathy, that's exactly the same. Your point about dental, 100%. And I would just say what it feels like is there's a lot of really interesting supplemental benefits out there. The ones that I think that members gravitate to the most first is the ones that help them with the financials. So, this is a population that is on fixed income. So when you see things that are used a lot, like, most seniors, they need dental care, going to the pharmacy, which they do all the time, and having this OTC benefit. So those are the ones that definitely are the most popular. And I think it's because of those reasons that you have a fixed income population, and here's really, sort of money that they would have to spend, but it's putting money back in their pockets, which again, I think is one of the reasons rewards are also important. And I think the emerging piece that we will send or see is the piece with, Kathy mentioned the caregivers and the in-home support, some of those programs that are really trying to provide some services for seniors who may live alone, deal with isolation. I think those are secondary right now just because they're emerging, but I think they could provide a real benefit to this population.
Okay. Thank you, Kathy and Stacy. You guys both itemized out 5 different kinds of new programs that have been really, really super popular. We do have a number of questions coming in, but before we get to the questions, I want to just give all the panelists just a little bit more time on aging in. Kathy mentioned it, the wave of millions and millions of increasingly more consumers coming. Catherine, I'll start with you regarding data analytics, right, and programming ideas as it relates to different consumers aging into Medicare, and then we'll turn it back over to Stacy. So Catherine, from an aging in perspective, what are your thoughts?
Yeah, I think this is a huge area for us to focus on. I did mention a few minutes ago on some program planning, there needs to be an awareness aspect to that and over communicating. In fact, there is probably no such thing as over communicating when you're trying to get people to engage in something. And I know from personal experience with my parents having aged into Medicare a few years ago, what that process was like. It was so confusing. We knew that there was Medicare Advantage and traditional Medicare only because we had recently our work here. But I think part of that is really, thinking about, and you heard Kathy mention this too, like when you turn 65 with Amazon, your experience is exactly the same. So if we can use data to understand when people, and first of all, it's not even necessarily a data thing, but just literally an age thing. If you understand that proportion of people who are about to kind of get to that place in their life where they're going to have to make that decision about Medicare, you can start pushing things towards them. And this is where we're using data, obviously, to understand who those people are from an age perspective, but then we can also marry that up with, again, any information we have related to their persona and the way they may engage, or just their own individual behaviors in our programming so that we understand how to push this information to them, making sure they understand what Medicare Advantage is, highlighting the benefits of remaining with their plan because the program in the platform is similar, so they'll be familiar when they log into their Medicare Advantage program and they have been a commercial program, member. The look and feel is the same, even though the content will be different and that kind of thing. So leveraging what you know about that person to make sure they understand that this is an option, what those benefits are, start doing, awareness and education as part of this, kind of leading up to that 65th birthday when they may be making some of those choices. And we actually do it a little bit younger than that as well, because you've got people who are maybe early retirees in that 62 kind of time frame. I think is an important piece of making sure you can target these people effectively so that they even know that this is an option out there, and making sure that you've got that in their minds and kind of give them some of that support along the way that's filtered into some of the other information that they're consuming in that, again, that really engaging and relevant way for them. I think that's an important piece of this.
Great. Thank you. Stacy, what are your thoughts with your population? And I know that Alabama in your plan has got really great market share in your particular service areas, but from an aging in perspective, what kinds of things have you done that you'd like to share?
This is a really important topic for us, and I think one of the biggest things is, well, there's 2. One is we want them to feel like, if they have been with us for 20 years, that it's not like they're coming to a completely different company when they roll over onto Medicare Advantage, which in some situations it can feel like that. How can we leverage the experience and all of the data that we have when they are aging into Medicare and make it as seamless as possible. We actually have a strategy that we call our year one experience, where we're taking a look at all of those different aspects to determine how can we really make this a better experience. And it all boils down to adding value to the member. As Catherine mentioned, I've helped my parents with this as well, but going from, if you've, had commercial insurance, it is a completely different experience, whether you're getting a, C-plus plan with a standalone drug plan, or whether you're going to Medicare Advantage. You start to hear things about, the different drug phases, and you get all these supplemental benefits. It is just very, very different. There are so many different plans available. It is so confusing. Seniors they don't know where to go. They don't know how to understand it. So I feel like the way we can be the most successful is adding value to them, making it easy for them, meeting them where they are, helping them know that we know them. Here's what we have seen from you in the past. Here's how we think this is going to help you, really leveraging that history that we have with them.
Mm-hmm. Yeah, that makes a lot of sense from a consumer perspective. How about Florida? Kathy, what kind of aging in things have you guys done?
Yeah, bottom line, and we have a huge age-in book coming from our huge commercial book, but just talking from a human being standpoint, we have to shift from a transactional sales process into a relationship and education, and then put the sales process in there, then talk about the benefits. I'm telling you, turning 65, or even people at 62 that want to retire, and I'm in the business, you have to really understand Medicare and your options, whether you're a working agent that I am, or you're retiring at 65, and it goes beyond just your medical benefits. It said, my Social Security, how do I pay my Part B? What's Part A, and do I qualify for that? So it's the mechanics of Medicare that people want to hear. And that's where the trust comes in, whether they're part of your plan today as a commercial person, and they can come in and they know you as, Alabama Blue or Florida Blue, whatever. It's the fact that you have to understand Medicare. Then you go pick your plan, and then you look at the benefits, if you will. And let's not give people, if you have a commercial book, don't give them reason to want to leave that family, but help them understand Medicare, because it's Medicare in itself is the complex issue, and not just for when you age in, but what's going to stay with you as you travel through this journey, because we're all human beings, and our mechanical bodies are just going to break down at some point, fact of life, I guess. But I implore people to start there. For the person that's coming about and coming into that age group.
Great. I love how you brought it to a practical level of the mechanics, and that's something that is so critical and complicated as people are aging in from commercial. Okay, so I'm gonna go into the feed here from the webinar and pick a number of questions that have come through. Actually, a couple of these are kind of the same. Here's the first one, and we'll do these up until about a minute left, and then I'll give the panelists a minute or two to talk about the future and what you see in the future. But here's the question: what will be the impact of the latest changes that the CMS has made to its star rating system? There was an understanding, at least on this question, that they're putting greater emphasis on member experience. Stacy, do you want to take that one first, and then maybe Kathy?
Sure. And I'll go back to what I said, initially is I think it really is about how you, overall, how you operate, what your overall strategy is. It's not these tactical, hey, I'm going to do this to, address this one measure. It is really about how you take care of your members, how you work with your providers, how you engage your members, how you enable your providers, and how you really link it together and really make navigating a complicated healthcare system easier for your members, who are the ones that, interact with it the most as we age. I think it's keeping them at the forefront of all that you do, and just making sure that, you know, you have the pulse of the member, whether it's, you know, using the data that you have, whether it's, you know, doing listening tours with the membership, really trying to implement solutions that are going to meet their needs. I think that's how you're going to be successful in this new world.
Great. Kathy, thoughts on that question? That CMS
Yeah, I'm
is,
just going
to,
Stacey said it perfectly, but just to add a little bit on having that healthy living plan that's integrated both with the provider, a caregiver of your choice, or someone else, and you as an individual, that you're doing it together and you're staying connected, and all the rest will take care of itself, so that you're getting the right care at the right time, you're having the right meds, etc. And then the social determinants of health, whatever you need there is linked in, and that's what I just put it back to the healthy living plan that we all should have.
Great. There was another question about, Medicare Advantage plans have continued to grow in popularity in the recent years. Do you guys see that trend continuing, and if so, why? So I'll turn it back over to you, Kathy, and then Stacey on that, and Catherine, for sure, feel free to chime in too on this. So do you see that continued growth in popularity?
Absolutely, and I've been a believer since 1997 that it would get to this point. So, and here's why. Because of the value-based networks that are being put together, value-based care, the integration that you're seeing out there between, that you just saw, what you're seeing with pharmacies coming together with provider plans, etc., that the people are going to want to have a clear-cut path where they can see it, they can own it, and they can do it with their healthcare with integrated groups. So all that integration coming together is all about managed care. Managed care is, people think that, oh, it's managing the cost. It is managing the cost, but it's managing the care so you can get the appropriate care at the right time, so that it should mitigate the costs. So yes, I'm a big proponent of managed care. It'll morph, maybe look different, but it'll have the same type of components.
Great, thanks. Stacey, thoughts on the popularity?
I completely agree. I say this all the time, but I sort of drink the value-based Kool-Aid. I don't think fee-for-service is the way to go when you're thinking about a member sitting there at the end. I think Medicare Advantage has really allowed a lot of innovation for that. So yes, I do. I think we will have to watch the continued payment pressures from, MedPAC and others on the Medicare Advantage program, but I absolutely think that it is a wonderful program that's added a lot of benefit to members, and it's here to stay.
Thank you. There is another question, but I'm just going to recognize the question there. It was about non-traditional benefits that would target social determinants. I think we covered that pretty extensively, so I'm going to leapfrog that one. And since we only have 3 minutes left, I would love for each of the panelists just to give your point of view on the future of Medicare. Like, what does it look like in the next 3 to 5 years? And then we'll go ahead and wrap it up. So, Catherine, do you want to start? What does the future look like in a minute or less? And then I'll turn it over to Stacey and then Kathy.
Yeah, I will definitely start with that. So I think, you mentioned, Glenn, I think it was you earlier, there is so much data, and we create more data in an hour than we used to create, in months and a week, months and a year, back in the day. So there's a ton of data that's being created all the time. And I think what Medicare will learn and lean on more and more is all of those other data sources that are non-traditional that can kind of fit into that overall kind of sort of kaleidoscope view of a person, where you can make that really clear and understand how they may want to be engaged with. I think we will also have more and more of these sort of supplementary non-traditional program assets being included, because that is going to be a huge part of what enables a person to actually take advantage of those things, much less know that they're out there. And then lastly, I think the digital portion of that, which is again bias here on the data side of things, being able to take in that data along with understanding what those ancillary programs are so that you can serve that to somebody in a really simplistic fashion, making it as easy for them as possible to do what they need to do.
Great. Thanks. So Stacy and Kathy, a few words on the future, and then we'll wrap. Stacy?
Sure. I think that we are going to, again, continue to see increased popularity. I think I'll be interested to see where the interoperability goes and the innovation within value-based payments. I think personalization is going to be key and continue to increase and expanded digital engagement.
Great. That's a great summation. So Kathy, your final words on the future.
So my one just question, we have to figure out between all of us, no matter where you sit, how we're going to pay for all this. But besides that, the big balance between high tech, high touch, we need multi-payer alignment, cross-cutting initiatives so that we all can leverage it for the individual. Want to see there's going to be health equity that is going to play a huge role, which is great. And the Medicare in the home or just being in the home for care. Supplemental programs such as long-term care and non-certified care, I think we're going to see more of that on roll, and it'll be more person-centered, but it'll be everybody playing together in this game, from the receiver to the sender and to the intermediaries that are out there. But we have to get some alignment on some of those cross-cutting initiatives that I'm hoping that CMS is going to be helping us do that as an industry.
Thank you. And I can't thank the panelists enough and the audience enough for taking the time today out of this extremely busy time of year. So thank you. A lot of really, really great content. So thank you to the panelists. I also want to apologize for any technical difficulties we had today. I know that the audio was not great the whole time, but I just want to recognize we sincerely apologize for that. So thank you, everyone. Have a great rest of your open enrollment period and the fall, and look forward to staying in touch on future webinars. So thank you, everyone.
To our speakers, thank you for that great presentation and for sharing your thoughts. Thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again, and enjoy the rest of your day.